You should always wash your hands before interacting with the patient. Always begin by introducing yourself and confirming the patient's name and date of birth. During this time, be sure to explain to the patient what it is you'll be doing, in this case, a heart exam, and make sure to obtain consent, especially for things like palpations and other physical contact. This time can also be used to ask the patient any questions you may have. Some questions could be asking about chest pain or shortness of breath. So to start, we want to take a look at the hands. What we're looking for are signs of cyanosis, or a blue-grayish coloring of the skin. Ask the patient to put two fingernails together as shown. This can be used to assess for finger clubbing. Now, ask the patient to open their hands face down so that we can check for capillary refill time. Now we will check some pulses. To begin, we will start with the radial pulse. Count the pulses for 30 seconds and repeat with the other arm. Next, we will check the carotid pulse, which can be found in the neck. Remember to inform the patient about what you are doing and to position yourself so that they don't feel like they're being choked. Again, we count the pulses for 30 seconds and repeat on the other side. Have the patient sit back about 45 degrees. From here, instruct the patient to turn their head to the side. This will allow us to observe any abnormalities in the jugular veins. Now, we want to take a look at the eyes. We are assessing the eyes for any signs of abnormalities or hyperlipidemia. Now, we are assessing for any ascites. While applying pressure on the abdomen, ask the patient if they have any feelings of discomfort. We want to make sure to assess the lower extremities for edema or any abnormal coloring of the skin. Be sure to compare both sides. As we take the patient's blood pressure, we want to make sure we know any medications they are taking that may affect it. It is also good to know if the patient had any previous complications with blood pressure. So the last two things we will be doing is listening to the heart and lungs. To start, we will inform the patient where we will need to palpate in order to hear these sounds. Be sure to obtain consent before starting. The aortic valve can be heard at the second intercostal space just right of the sternum. If materials like clothes or sports bras need to be moved, please ask the patient before doing so, or ask them if they can move it for you. The pulmonary valve can be found at the second intercostal space, but to the left of the sternum. Be cautious of your hand placement, especially with women. You do not want to rest your hand right over their breast tissue. The tricuspid valve can be heard at the fifth intercostal space to the left of the sternum. Remember to inform the patient and ask before having any clothing moved out of the way. The mitral valve can be heard at the fifth intercostal space at the left mid-clavicular line. With women, you may need to ask them to lift their breast tissue up and out of the way. Lastly, we want to listen to the lungs for any abnormal sounds during respiration. Again, be sure to inform the patient what you are doing to avoid any possible feelings of discomfort. Here is a list of possible indications for right-sided heart failure that a patient might present with. Since the right side of the heart pumps blood to the lungs, the body is now not getting the oxygen it needs, which could lead to fatigue. The malfunction could also lead to a block in the venous system, which increases the pressure. This increase in pressure can also cause fluid to leak out and cause edema, which is fluid buildup in the tissues. This is why it's important to assess the lower extremities for signs of pitting edema. Thank you for watching. Here is a funny heart comic for your viewing pleasure.